So welcome to our lesson on the bones as part of our anatomy chapter here in our Lower Back Secrets program. This lesson is going to be dedicated to understanding the bones as related to the anatomy of why we have lower back pain. So when it comes to everything that we're learning, that we're going to learn, the first thing is first, and the first thing is going to be, okay, let's learn the basics. Let's learn a little of this anatomy. Let's see what these bones are called and how they really work and the whole structure, and that way we can realize why something is going to be aggravating as opposed to why it's going to be helpful as we really learn this system, okay? So we're going to start with the bones. The first thing to understand is that we are really dealing a lot with our pelvis, okay? So of course we're talking about the spine, and we'll be discussing the spinal anatomy for sure in detail and discs and everything like that. But we're going to really just start by talking about the pelvis. Now the pelvis, although it functions as one structural unit, it's actually made up of 3 bones. Okay, the pelvis is made up of 3 bones. You have this top section here and this upper section, which is called the ilium. We have the bottom section here where your sitting bones make up part of that bone, and that's called your ischium. And then you have the pubic bone in the front. Okay, so we're going to have a pelvis that's made up of the ilium, the ischium, and the pubis. Okay, and in the back here, which is not really designated as actually the pelvis itself, this is the sacrum. Okay, and the sacrum is actually part pelvis and part spine. Okay, so the sacrum, and in here what we're going to talk about soon, we talk about ligaments, will be our sacroiliac ligaments. Okay, so we have a pelvis, we have pelvic bones, and within that context we have the sacrum. Okay, well let's look at some other bones. You're going to have your leg. Okay, so the leg bones are pretty easy. There's only a few of those that are important in relation to the lower back. We have our femur, which is our big thigh bone. The kneecap is the patella, and then you're going to have a big bone on your shin, which is called your tibia, and a small bone off to your side called your fibula. And these are going to be related to what we call the hamstring muscle group, because the hamstring muscle groups are going to be attaching onto these muscles, onto these bones here from the back as they come up, and we talk about the muscular anatomy in a different lesson. Now, as we carry on with some bones here, we'll just take a real simple look at the rest of the skeleton, just so we're clear on some names. We have the skull, okay. We have the mandible, okay. A lot of people get pain in the jaw reflected from pain in the neck. And you know, we're not talking about neck pain in this particular context, but this is called our mandible. And now we have the spine itself. The spine itself is divided into 5 parts. We're going to have the part that is called cervical. There's going to be 7 vertebrae for the cervical. We're going to have the section called thoracic. There's 12 of those. We're going to have the section called lumbar. There's 5 of those. We're talking about vertebrae. And then the sacrum, which we just looked at, and then the coccyx, which makes also known as the tailbone. So here in this context, here's our ilium, here's our ischium, here's our tailbone, here's our sacrum, and here's some of the lumbar vertebrae. Just kind of get acquainted with these anatomical terms, because I'm going to be saying things like pelvic rotation. I'm going to be talking about, for example, parts of your spine, and let's just appreciate how the spine is numbered and how it's named, because you know, a lot of people, you know, they hear, oh, I have a herniated disc, and then they see where, and they go L4, L5. And be like, oh, what is that? A bunch of letters or a bunch of numbers? What does that even mean? Let's make sure you understand what that means. It all starts at the top with C, and there's C1, and C1 goes all the way down to C7, which is the one that sticks out the most. But then after C7 starts T, thoracic, number 1. And you have T1 goes all the way down to T12. And after T12 starts the L's, the lumbars. And then you have 5 of those. And that goes L1, L2, L3, L4, L5. And after all those L's, all those lumbars, starts your sacrum, and then starts your coccyx. Okay? So that's what it means when they give you a letter and a number. They're talking about what vertebrae and then which one is it in that context. Okay, well, now you just for the sake of completeness here in this little lesson, we have a sternum, we have a clavicle, we have a scapula. Okay, the humerus is the arm. We have the radius, which is the small forearm bone that goes to your thumb. We have the ulna, which is the big forearm bone that goes to your elbow or goes to your small finger. And then you have metacarpals, or the wrist, and carpals are your fingers. And so that's kind of your basic skeleton, but most important, of course, is going to be the discussion of the spine, the pelvis, and the leg itself, because that's where the hamstrings are going to be found, and we're going to see in these later lessons the relationship that the hamstrings are going to play in this entire picture. Okay, so that is our lesson on the bones, and we will be seeing you in our next lesson, which is going to be covering many more aspects of anatomy as it relates to lower back pain.